Vata predominates, then the retinal epithelial changes become uncorrectable. Extensive pigmentary deposition causes pigmentary degeneration. Then degeneration of vitreous occurs. That means the liquefaction of opacity. Normally, vitreous is a colloid-like structure. That became liquefaction started and become opaque. Opaque means it's a clear fluid normally. When opacity occurs, there is dimness of vision started. The degenerative vascular changes of choroid causes choroidal halos and this is in macular region, resulting in Foster-Ford spots. The Foster-Ford spots are some pigmentary lesions due to the degeneration of macula and subretinal neovascularization. Normally, neovascularization means new vessel formation due to the degeneration or the lack of blood supply there. New vessels are formed, but the new vessels are not healthy. They will rupture and causes bleeding also, and causes some pigment relations. It is called Foster-Ford spots. It is mainly seen in the first degenerative stage. This is a Foster-Ford spot seen through the ophthalmoscope. Degeneration of macula. Then coming treatment is directed towards Vata Pitta Shamana, because here Pitta involvement is there. Therefore, the line of treatment should be Vata Pitta Shamana. Chakshushi and Rasayana drug help in improving the health. This may be done with drugs like even Jivaniya Grida itself. Jivandyadi Prativarshanasya we can be done here. Then Shirabala as Murdadaila. Then Draksha Chandanadi as Tarpana, because these are Shida drugs involved in Draksha Chandanadi. It helps in the decreasing the vitiation of Pitta or for the stamina of Pitta. The next is the stage of degeneration. Actual stage started, the progression of vitiation of Vata and Pitta result in further degeneration of retina and choroid and vitreous. Findings: posterior staphyloma occurs. Posterior staphyloma means the bulging of eyeball due to the thinning of sclera. Sclera gives the structure to the eyeball. When what happens when sclera become thin, the posterior part of the eyeball become bulged. That is staphyloma. Then subretinal revascularization and choroidal hemorrhage seen around Ford spot. That means new vessels formation can be seen through the ophthalmoscope. Then aqueous cracks. Aqueous cracks is nothing but these are breaks in the Burt's membrane seen in the posterior pole, which is seen in high myopia. The fundus is same as in axial myopia, but maybe hemorrhage due to mechanical cause or neovascularization. There may be stretching of retina. This is the degenerative space. Then this stage is best managed by Chakshusha and Rasayana drugs. Then Grida like Vidaryadi, then Murdadaila with Kshirabala, Tarpana with the Jivaniya Gada itself, Rasayana Prayoga, like Amalagi Rasayana Prayoga is useful. Then the last stage is stage of complication. Upadrava occurs due to Tridosha Prakopa. In myopia, in pathological myopia, the last stage is stage of complication. Main complications are the glaucoma, vitreous detachment. That means vitreous is in close contact with the retina. When the retina detach, vitreous may also detach, or the vitreous itself may detach from the retina. Then chorioretinal atrophy can be seen. Posterior capsular cataract, because the lens is in close contact with the posteriorly with the vitreous. Therefore, due to the Tridosha Kopa, there may be anomalies in the vitreous and causes anomalies in the lens itself. That is posterior part. Posterior part is close contact with the vitreous. So posterior part posterior capsular cataract is common. Then retinal detachment may occur. Then blindness. And surgical treatment is inevitable in this case because the retina is damaged. This is chorioretinal atrophy. It is seen in this is due to the thinning of retinal pigmented epithelial layer that permits increased visualization of choroidal vessels. Normally, the first picture is normal retina. We can see the retinal arteries, but the choroidal arteries are not visible. But in the next picture, we can see the choroidal vessels. because this is due to the thinning of retinal pigmented epithelial. That means the retina became thin. Therefore, we can see the vessels underlining the retina. That is choroidal vessels. An advantage, better visual prognosis, prevent further deterioration of visual acuity, and complications are minimized. Improvement of ocular health along with vision. In some cases, the degree of vision may not increase, but the health of our eye increases. Patient is itself tell about the uneasiness of the eye in looking to light or even reading, etc. Then refraction is facilitated by the Vata and Kapha. Imbalance result in refractive errors like myopia, as we have already told. Then the first stage, that in the first stage, it is in pathological myopia. We should keep in mind first stage it is Vata Kapha predominant. Second stage Vata. Second stage and third stage Vata Pitta involvement is there. Fourth stage also Pitta involvement. Fifth stage that is the stage of complication. Here Tridosha line of treatment should be Tridosha Samana line of treatment should be adopted. Proper understanding of these stages help in the management better. Then coming to Tarpana, Netra Matra Asrade Male, that means when the Mala are situated only at the Netra. That means the impurities should be eliminated from the body from the by Virejana, and impurities from the serous should be eliminated by Nasya, and then only we should then only we should do Tarpana. Before doing Tarpana, we can do the Snehapana, Vicharana is enough. Especially in children, most commonly we are giving Jivandhyadigrita, Padoladigrita, and Tripalagrita. It's these all are available in easily available in our markets. And for Swedana, mild hot water bath is enough for children. Then Virejana, we can give Avipatti Churna or Erenta Thaila Avipatti Churna 10 gram. Depends on the age. Then also Erenta Thaila in milk that we can give for Virejana. That is only for one day. In the next day, we can start Nasya. We can use Anu Thaila, any Virejanasya we can do. Then after Nasya, we should do 3 days Anjana. After Anjana, there is Chalana. Immediately after Anjana, there is Chalana. Then Tarpana, Tarpendi, Tarpana, that means to nourish or irrigate or gladish. Tripti Karanam, Karmam, Tarpanam. One among 7, as we have already told about the 7 Kriya Kramas, it's very important. It is indicated for Vata Pitta Vigaras and preventive aspects. It should be only after severe, should be avoided in some conditions, that is such as redness, lacrimation, pain, foreign body senses, exudate discharge. In these conditions, Tarpana should be avoided. The contraindication is too cold, hot, and rainy season, and for Nasya Anarha, because Nasya is a Purva Karma in Tarpana. For Nasya Anarha, Tarpana should not be done. And these are the indications. Namyadi Saptada. So these are the theoretical part. Weakness, tired, paralysis of the eye, xerophthalmia, that means Shuktada, that means dryness of the eye. Rukshada means dryness of the eye. Abhigada, dromas. These are all indications. Jihmada, that means bended, otherwise skinned. Then Jirna Paksha, medarosis. Jirna Paksha means medarosis. Then Avila Netra, that means smoky vision or blurred vision. Krichronmila means blepharospasm. Then Siraharsha, Sirolpada, etc. We can do Tarpana. Dimness of vision, subconjunctival hemorrhage. In glaucoma, you should thoroughly notice the dosha predominance, and we can take sufficient medicines for Tarpana. The procedure of Tarpana, it's very, you can see procedure of purification only, as we had already told. Vamana, Virejana, Vasti, Rektamoshana, and that of head by Nasya are to be done prior to the Tarpana. Sponge baths, the closed eye with lukewarm water. The Pradhana Karma, the time should be morning or evening. Tarpana should not be done in midtime. Place of admission, room devoid of wind, dust, smoke, etc. Other disturbing factor should not be there in the Tarpana room. Then it should be done only after previously taken food is properly digested. The patient is allowed to lay on his back a herbal paste boundary of 2-inch height made of yava and masha around the eyes to keep the medicine in position. The medicated ghee is liquefied by placing the container in hot water and poured in the eye at the medial canthus up to a level of the eyelashes. The eye should be closed and open slowly. Medicine should be retained for specific time inside the herbal paste boundary. Care should be taken. In Vadakapa, the Tarpana should be slightly warm, where in Rakta and Pitta it should be cold. An increase in Tikshna Ushna Guna may lead to adverse effects such as inflammation and burning sensation. Decrease in quantity and temperature of the medicine may produce excessive lacrimation, difficulty in movement, pain, foreign body sensations, etc. In case of these type of complications, we can use mild fermentation by dipping cloth or cotton in hot water and wipe in the forehead and the cheeks, etc. Then care should be care to prevent complication. An increase in quantity and time of retaining medicines lead to complication like redness, shrinking, and spasm of ocular muscles. Decrease in the quality and time of retaining medicine may lead to provocation of doshas. Management of doshas we can advise for Nasya, Dhumapana, and Anjana. These are the matras for retaining the medicines for Tarpana. Sandhi 300 matra means approximately 2 minutes. Vatmaroga 100, that means 50 seconds can be done. These are all theoretical parts. We have made some small correlation for that. Then Sandhi, Vatma, Shukla Gada 500, then Krishna Gada 700, Drishti Gada 600, 6 minutes, and Adhimanda 1000. Time in matra of retaining medicines according to various acharyas are mentioned here. Then duration of Tarpana in days. In Vada conditions, we can do it for 5 days. Pitta condition 3 days and Kava condition 1 day. Most commonly we are doing here for 5 days. The time should not be more than 50 minutes. We can start it with 5 minutes, then we can next day we can increase up to 10 minutes, third day we can increase it to 15 minutes, then we can reduce its time to then 5 days. In Vada condition, these are all matras. Then Pachatkarma. After retaining for specific time inside the herbal boundary, the medicine should be drained into the vessel through a hole made at the lower part of the Masha Bali. Then clean with the Masha Pishta, sponge bath with the lukewarm water. Then do suitable to Mabana. Then Maladi Malliga Pushpa Bandhanam. That is the jasmine flowers. That should be done after sunset in the night and should be removed in the morning from the last day of Tarpana to the first day after Udavada. Then avoid direct wind, seeing luminous objects, sky, mirror, sun, etc. These are the Sammik Tarpida Lakshanas. Pragasha Shamada, Swasthyam, same the theoretical part, tolerance to light, health, then freshness of eye, lightness of eye, sound, sleep, color and complexion, recovery of illness, easy, close and open. Then Ati Tarpida Lakshana, that should be keep in mind that these are the heaviness, excessive dirt collection. Then excessive oiliness, then epiphora. Epiphora means watering. Then kandu, itching, upadeha, sticky debris collections, kaba provocation. These are seen in Adi Tarpita Lakshana. When it is not adequate, Hina Tarpita Lakshana can be seen. That is a Rukshadva, then darkness, Avilata, then Netrasrava, that means lacrimation or any discharge from the eye, Yoga Vritti, aggravation of disease, then Rupa Darsha, Avarodha, that means indistinct vision. These are all Hina Tarpita Lakshana. Main site of action we are considering is Drishti Nadi, Vatma, Sira, Netra Kosha, Asru Gandhi, then Asru Marga, then brain centers. Then nowadays we are using medicines for Tarpana. We can use except Taila, we can use all snehas except Taila we can do for Tarpana. Mainly we are doing Grita Mandam, then Jivaniya Ganata Kritam, Sadahwadi Tarpana Kritam, Anandadi Kritam, Daksha Chandanadi Kritam, Panchamrata Kritam, then Kagolyadi Ganakritam, Durvakritam, Tanduliya Mulakritam, then Vanaspatiadi Kritam, Chira Sapti, Ainayadi Tarpanakritam. Most commonly, we are doing with Jivaniya Ganakrita and Sadako Tarpanakritam. These two are easily available in, and also Tripalakritam is usually available in our market. Then coming to Pudapaga, after Tarpana, the eye should become dull and weak. Tarpananandrasya, Klandasya Netrasya, that means the shield or the weakness of eye after Tarpana should be avoided with Pudapaga. Following, hence it is mandatory to strengthen the eye by the administration of Pudapaga. Then indication procedure is post-operative measure same as that of Tarpana. Contraindications of that Nasya, Tarpana, Sevana. The medicine for this local application is prepared as Pudapaga Vidhi. These are classifications of Pudapaga. Administered in Duksha Netra in Vada predominant conditions. Medicine kept in eye for 200 matras. Then administration 2 days. Formulation Anupamamsa, Vasa, Majja, Kagulyadi can be used. In Lekana Pudapaga, Adisnigdha Netra. That means in Kapha predominant, we can do it only for 1 day. Formulations Jangala Mamsa, Yagrut Mamsa, Trigadu. These are Lekana drugs. Pravala Basma, Saindava, then Kasisa Basma, Prodonjana, Dadi, and Mastu can be included in the Pudapaga medicines. Then Ryobana Pudapaga. In Vada, Pitta, and Rekta predominant diseases, and also for ulcer healing. That is medicine kept in the eyes for 300 matters can be administered for 3 days. Normal formulations are Jangala Mamsa, then Madhu Grita, Tikta Drivya, Stanya, etc. In Kapha, Pitta, and Vada diseases, Tarpana is to be done respectively for 1, 2, and 3 days. Days from the Dalhana Acharya. Then Prasada Pudapaga, Susrata and Vagpada explains Prasada Pudapaga mainly with Mathura Drivyas, Yakrit, Majja, Vasa, Andhra, and Hridaya of Jangalam Mrgapakshi is used. These are the materials for the methods: meat, raw drugs, Dravadrivya, clay, leaves for wrapping it, then clay for applying on its top, and we should make a fire with charcoal or cow dung and make it red hot, and after Swangashida it should be opened. The preparation, the well grind meat and raw drugs are well mixed and grind with the Dravadrivya, and this very smooth paste it is to be made, and it's made to be to a bolus. It is safely covered with the prescribed leaves and well coated with clay and roasted in fire until the clay becomes brick red in color. Then after cooling, we are opening it and we are squeezing it and filtered it. Then these are theoretical part. Then Tarpana, commonly we are using these 3 drugs in Kerala, mainly Jivaniya Tarpana, Jivantiya, Tripala. These are easily available here. We are doing in 1 to 5 minutes in first day, then second, 1 to 5 minutes, then 2 to 10 minutes, then third day, in the first day for 5 minutes, then second day 10 minutes, third day 15 minutes, fourth day 10 minutes, and again decreasing. Then Pudapaga we are making Jivaniya Gana with Jivakam, Idavakam, Meha, Mahabeta, Kagoli, Shirakagali, Mudgavarni, Mashavarni, Mairichap. Okay, this can be taken each in 25 grams, and also goat's liver, Jangala Mamsam can be added. We are covering it with the lotus leaves, or we can use Ayaranda Patra. Then we can make it in a pressure cooker itself. But once keep in mind that the entrance of water should be avoided. No dish, 2 dishes, one with the lid, twine, etc. Then coming to Snell's vision, these are the instruments used for testing the visual acuity. This is the trial set. This is plano-concave mirror, the ancient retinoscope. Nowadays, this is not using. Instead of this, we are using streak retinoscope. This is a streak in how it is examined in dark room. We are dilating the pupil, then we are making a streak of light to the eyeball. Then we can see the streak is illuminating in the pupil. When the streak is moving to the right side, with movement, in case of hypermetropia, what happens? The motion will be with movement. That means when the streak is moved to right side, the image or the streak glow, there is a glow we can see inside the pupillary. Small glow can be seen. That will also move in the same direction. That is in hypermetropia. But in myopia, when the streak is moved to the left side, the streak glow in the pupillary region will move to the opposite side. That's in myopia. We are neutralizing this with the lens. Then streak angle change also we can be calculated by this. Then errors of refraction. Then astigmatism coming. These all are prescription of astigmatism. Then coming to presbyopia. Presbyopia usually comes after age of 40. Presbyopia can be correlated by giving convex spherical lens in addition to distant vision lenses. For presbyopic correction, bifocal lenses are used because in presbyopia what happens? The distant vision and the near vision both are affected because the elasticity of the lens is lost. Therefore, we have to give both the powers for distant vision and near vision for the patient. Normally, when we are giving specs, we are correcting the distant vision first. The near vision we are adding to that distant vision power. First of all, we should correct the distant vision. Then near vision power is adding to that distant vision power. Then this is the addition of plus power in in presbyopia. About almost in 40 years age, we have to add +1 power to the glass. First of all, we should correct the distant vision. Then we should, if the patient is with the 40 age, we should add +1 to that lens. In 45 age, we should add +1.5. In 50 age, we should add +2. And in 55, we should add +2.5 to the corrected distant vision. First of all, we should correct the distant vision. Then we are checking the near vision, and it is added to the distant vision powers. This is what is happening in curvature of happening in astigmatism. Normally, the cornea is dome-shaped, smooth, but here, see, it is having a bulge-like oval shape. It is having two meridians. So the light rays will not, the perpendicular and the horizontal light rays will not focus on the same point. This is what is happening in astigmatism. See, the green shade is the 90-degree light rays. And the 180 degree, as we can see the red color, that will focus in one focal point, and the green light, that is the vertical light rays, focus in another point. In both conditions, both the focal points are in front of retina. That means this myopia with the astigmatism, myopic astigmatism. In this case, we actually we are doing correction with first we are correcting with the cylindric spherical lens, so that what happens, the red shade will reach the that orange shade will reach the back, red shade, that is retina, will reach the retina. That means the light rays from one meridian will reach the retina by using spherical lens. Here the a 180 degree meridian reached the retina, but still the 90 degree meridian is in front of the retina. Here we have to, here we are increasing the spherical lens, that orange shade will go beyond, the patient feels the blurriness. Therefore, maximum correction we we will when the patient get maximum correction, we will stop there, and then we are adding cylindrical lens so that rest of the light rays, that is that green shade will reach. That means the vertical meridian will reach the red area, that is the retina. With only the sphere correction, spherical lens, only one, there are two focal points A and B, both move towards the retina. Focal point A is now focused on the retina. No refractive error is corrected to the focal point B. Then, but still in front of the retina, leaving a smaller refractive error, we add a cylindrical lens to correct the remaining 1.5 diopters. The refractive diopter of the refractive error to the cornea at the 90 degree. This will only move only the light color, that means which now focus on the retina. The retina, in this case, the lens only corrects only 90 degree. Is that a cylindrical lens has power in only one direction. That we have this this is the type of, we are correcting the astigmatism. This is slightly complicated, but if we are doing 1 or 2 times, you will be very familiar. Otherwise, it will be slight boring, because we have to do it in the OP with our trial set lens set. Then only it will be clear. Then, so in this case, see the orange shade and the green shade, both focal point reach the retina. Here what we have done is, we have used the spherical lens to move both the focal points to the retina, but first the orange shade reached there, but still there is the vertical meridian still in front of retina. Here we have to do add cylindrical lenses. This is a practical step, then only you will get a correct picture. Then coming to the eye exercises, as you know, these are the common eye exercises. Move up, then down, then right, left. These should be done for at least 5 minutes. Don't do eye exercise in an eye strain condition. That means if there is any severe pain or photophobia, don't do eye exercise. When the symptoms like photophobia, eye strain, watering is subsided, then you can do only blurring your vision. You can do eye exercise. Start with 1 minute. Then the next day you do for 2 minutes. Like that you do for 5 minutes. This is palming. In every step of eye exercise, there is palming. Palming, that means we are closing our eye with our cup of palm, and don't touch the eyeball. The hand should be like a cup and place over the eyeball. Then the rotating movements, we can rotate clockwise and anti-clockwise. Then figure of 8 like movements for the eyeball. Then pen exercise, that we are keeping a pen or finger at a distance 1 meter from the hand. Then concentrate on the nail, then slightly make it close. Then as much as possible, then close your eyes. Then again place that finger in the 1 meter, then allow them to come closer. This is we can do eye exercise by drawing a 1 meter length, 1 meter line, like plus and diagonal lines. The center of the point should be in the same level of our eye. We can look through that line from the from top to bottom and from side to side, and also from diagonal. This should be done for 5 minutes. Then we can, after doing this, we can do Tribala Kashaya wash. Then these are some eye exercise, that is sunning. You should take or do the sunning in a slight sun, that means in morning or evening. The better time for eye exercise is morning, because in the evening eye is very much tired by the day-to-day work. So don't strain it. The better time is for eye exercise early morning. Then ball exercise. Give children also ball, playing cricket, football, like ball, looking to the ball, especially moving objects is a good exercise for eye. Then this is swinging movement. That is, we are looking to each bar, then looking to one bar, and then we are looking between the two bar to a distant object, then to the next bar, then between next gap to the distant object, like that, by swinging movements. Then this is a candle light concentration. Just look on the candle and look the color of the flame, then the aura like appearance, then the shape of the flame, that we just concentrate on it with each eye. Then cold part after exercise. Then some advices for children is that not only children, for refractive errors nowadays it is increasing. The best sitting posture is sit erect while watching computers, televisions, phones, etc., and do eye exercise and some yogas. Yogas, especially the Tradana, Bindu Tradana, Jyoti Tradana. Jyoti Tradana is same as that of our candlelight. While concentrate on the Deepa, then also include green leafy vegetables in our diet. This may be very, very helpful for our eye. Then thank you very much.
Thank you so much, sir. Now the session is open for discussion. Kindly put your queries on the chat box. We have received some of the queries, sir. I'll read it out for you, and we'll have the discussion.
Okay.
Sir, one of the questions is that, sir, why Pindi is contraindicated in keratoconus?
Pindi is contracted because. Can you hear me? Hello?
Yes, sir, we can hear you. Yes, sir. Okay. We can hear you.
Actually, Pindi is a procedure where the medicine is prepared into a paste like kalka, and we are wrapped in a in a gauze piece and placed over closed eyes, and it is bandaged for 12 hours. What happens is in some case, keratoconus, in some case of keratoconus, it is effective because it will give a support to cornea when it is bulged anteriorly. But the cause of keratoconus we should examine first, because in keratoconus may be due to the thinning of cornea. In that cases, we should avoid Pindi, because there is a pressure from inside and also the cornea is very thin. What happens, the central part of cornea may bulge outwards. In that time, we are giving an opposite strong pressure from outside. What happens, the cornea will become jam, because there is pressure from inside and we are giving pressure from outside. That will cause degeneration or damage to cornea. But in mild case of keratoconus, what happens, there will be no pressure from inside, but it is actually the shape of the cornea is altered and it will become cone shaped. There is no much pressure from inside. Therefore, we should take tonometry. Tonometry means we should we should read the pressure of the eyeball. That means intraocular pressure. If it is elevated, it is highly elevated cases, we should avoid Pindi, because as I told, there is an internal pressure from outward. We are giving an external pressure also. What happens, the cornea get jammed and maybe some degeneration may start.
Thank you, sir. So the next question is, sir, can we improve the vision acuity in high myopia?
Yes. First of all, we should in case of high myopia, in simple myopia, high myopia, you mean up to -6, -8, we can improve. But first of all, we should look for the cause of that myopia. That means it is due to the change in cornea or in the lens itself. But if high myopia, in pathological myopia, it is the power is very high. That is mainly due to the, as I told, due to the stretching of retina, stretching of vitreous, degenerate of vitreous, like that. That is the fourth stage. That is the stage of degeneration, and the stage of complications. In that stages, we should we can't get or the underlying cause should be avoided. That means in severe in glaucoma itself, what happens? There is blurring of vision. That is due to the stretching of the retina. Then we should treat for that glaucoma. Then the vision will be corrected, and also and the intraocular pressure should be controlled. Then we can do Tarpana. But in case of strong congestive glaucoma, that means there is in high tension or high intraocular pressure, that Tarpana should be avoided. And in high myopia, there is a complication, that is retinal detachment. As I told you, retinal detachment is a common in high myopia. That means there is dimness of vision, which is sudden onset and without pain. The patient will come to OP that I am not seeing, sir, but from the onset is very sudden. While taking bath or while taking by shaving, at that time when I closed one eye, I can't see nothing. That time the patient noticed it. This is a condition, that is retinal detachment. These all are complications of high myopia. In high myopia, we should rule out, or we should treat the causes like the retinal detachment, then these radial changes. Then only we will get the correct remedy for that. Otherwise, we can improve vision, but we can give some health to eye. That means the other associated symptoms like watering, the eye strain, that can be diminished. But in high myopia with degenerative changes, we can't get good results.
Thank you so much, sir. So the next question is, sir, how can we treat astigmatism through Ayurveda? And which doshas, what doshas do you find in astigmatism? The dosha involvement.
Okay. In astigmatism, in same as that of myopia and hypermetropia, we just take the case, that is what associated symptoms are there for astigmatism. That is the associated symptoms like blurring, then double vision, then avilata, that means the smoky vision, etc. We should take the which dosha is involved. In most commonly same as that of myopia, that is Vata and Kapha predominance is most commonly seen in astigmatism itself, because the light ray, the media is not clear. That means the light rays coming from outside, going through the cornea, pupil, lens, aqueous and vitreous, and then it have to reach in the retina. But that media is not clear. Therefore, the more than 2 or 3 focal points are coming. Therefore, it is the deflection of light rays we can correlate with the vitiation of Vata dosha, and the anomalies of vitreous and lens we can correlate with the Kapha dosha, because it's the medium or the fluid, the media, that means the lens, vitreous, etc. The anomalies in this media we can correlate with Kapha predominance, Kapha dosha, Kapha anomalies, and the movements or deflection of light we can correlate with the Vata condition. Therefore, in astigmatism also we are considering it as Vata and Kapha predominance. But in some cases there may be associated symptoms like pain or slight redness, slight burning sensation. In that case, there may be association of Pitta. The line of treatment is almost same, because in a simple, if there is no degeneration, then the line of management we can do in almost same in myopia and astigmatism. Actually, in both cases, there is no degeneration. In simple myopia and astigmatism, there is no degeneration. Therefore, we can do the Kabahara and Vata Shamana treatment. The eye have a capacity to regain to its normal position. Here, the Vata and Kapha predominance is there. Vata and Kapha are vitiated. We should correct it. Then it will come to normal condition. So here in myopia also, same as in astigmatism also, Vata and Kapha predominance is mostly seen.
Thank you, sir. So the next question is, what all precautions should be taken in Garbha Avastha to avoid Bija Dosha, which will lead to myopia in child?
In this condition, in Garbha Avastha, the Pumsamana Kriya, as explained in Sharirasthana, it is very important, especially in Garbhini. That means pregnant ladies should not lean forward overly. That may cause compression to that stomach, to the uterus. That may cause compression or straining in the uterine cavity. Then they should avoid Tishna Ushna property. Having Tishna Ushna food like pickles, etc. They should avoid it. These are all the same as that of genetic anomaly. We should take some precautions. That is, there is no medicines for that, but we should do some precautions like to improve the blood circulation and like yoga, slight yoga, then slight abdominal exercise. It's enough. But the Bija dosha we can't correct it because it is having some sahaja or mujjanma dosha may be seen. That we can't correct it. The most the largest thing we can do is avoid consanguinity marriage. It's very good in that, because doshas in both the partners are become same. There is chance for increasing. The dominant genes are there. It will dominate. If mother and father having the same doshas in same family, there are doshas are same, then there is chance for doubling. So the consanguinity should be eliminated. That's the first thing. In almost all diseases, this should be eliminated. As like in Netra Roga itself, it has an adverse effect. We should avoid it.
Thank you, sir. So the next question is, so most of the vegetarian patients who won't agree for Puttapaka because it contains Mamsarasa. So what can we do in such cases?
You can avoid Mamsarasa. That's so. Because actually we are not taking that medicine inside. You just do it, and there is not to tell to them. That's only we will get a good result with Mamsarasa. And otherwise, we can use like our even Shadaveri we can include in it. It's a good supplement for that. Shadaveri, Kalka, all add in that base. It's very good substitute for Mamsarasa.
Okay. Thank you so much, sir. So the next question is, how green leafy vegetables are helpful for refractive errors? Do they have any amlata which will cause harm?
No. Actually, we are refractive errors is associated with retina somewhat, because when we are getting good focal, we are getting good focus in the retina. What happens? The retina will also adjust to some extent to correct it. Or if the retina is very healthy, then to some extent the vision will be very clear. But retina is very, in case of retina is very weak what happens with that refractive errors? Retina also is weak. Therefore, there will be the adverse effect. The vision is very decreased. In that case, leafy vegetables, especially we are giving that say having good vitamin A. It is very necessary for the as you know, the pigment epithelial layer, pigments like rods, cones, etc. It is very good for the health of that layers. When the pigment layer, that means the retina is strong, then to some extent refractive the retina will adjust to clarify it. That's all for that.
Thank you, sir. So another question is that, sir, what all medicines can we use for pindi?
You can use yashti. Yashti means yashti madhu. Then honey made. Then lodra. Lodra means Symbloccus racemosa. That is lodra. It is pitta shamana. The yashti is also pitta shamana. We can make this powdered yashti madhu with honey and make it a paste and cover it with a gauze piece, and we can apply over eyelid. Don't apply directly to the eyelid. We should cover that pindi with a gauze piece, then place it over the closed eye and close it. Mainly we are using yashti madhu and lodra. Also, triphala can be used. Triphala, amalaki, bipitaki, haridaki, powdered and pasted with honey. This can be also used. It is tridosha shamana.
Thank you, sir. There is one more question. So, which Acharya has mentioned 2 weeks of Snehapana in eye diseases?
No Acharya, any Acharya is mentioned in 2 weeks for Snehapana. But as a practical, as the children are going to school, they are having only 2 or 1 month vacation. Most students are coming here in the time of vacation, so we are planning the treatment for 1 month. So as a practically we are giving for 2 months. 2 weeks Snehapana, then 1 day Sayadana, then 7 day Nasya, then 2 day Anjana, and 5 day Tarpana. Just for that practical aspect, we are made as a protocol for school children. Mainly simple myopia is most commonly seen in school children. Therefore, we are doing that like that. The no acharyas are mentioned like that.
Sir, thank you so much, sir. Won't you face practical difficulties when you do these in small school children? Maybe like we get a lot of patients nowadays. 4 years, 5 years, and all with myopia problems. So, how is it possible? Will they cooperate for Tarpana?
No. The first day and the second day is very, very difficult because they will cry. Because as the grida, when we pour to the eye, whether it is warm or slight warm or in pitta condition, even close, there is slight burning for grida. If we instill some even Sadahuadi or Duragrada in our eye, there is slight burning. They will not bear that. They start to cry. What happens when crying? Eye lacrimation occurs. We can see in the Tarpana fluid there are lots of water globules. We can see that will cause adverse effect. So we will give some good lessons for the not lessons. We will give some instructions not to cry because otherwise you cry, it will cause dimness like that. If the child is crying, no effect for that. So the first day we will face some difficulties like that in small child, but the next day we will manage it. He or she knows what is happening. He thinks that it's very the first day is slight burning, next day the burning is increasing like that. The first and second day there will be slight difficulty. Therefore, we are doing it only for 5 minutes in the first day and for the end of 10 minutes. In the third day itself, they will be cooperative. If they are crying, please stop that. That is necessary. We will get only adverse effect because instead of gridha, there will be full of water. That means full of tear. That means it's not good for that.
Okay, thank you so much, sir. Sir, there's just one more question is there. Sir, you have already mentioned about laser therapies. So, do you, in your practical experience, have you ever faced a patient coming back after laser therapy with again diminished vision or again the certain myopic problems or hypermetropic problems after laser therapy?
No. Nobody after laser. The main thing is that after laser therapy itself, they will give some specs for them, especially for distant vision. They will give some specs because in laser therapy they are calculating the extent of stroma or the corneal tissue that they have to take out. There may be some error in 1 or 2 patients in 100 or 1000. Most commonly that is very precise technology, but in some cases, rarely some cases, millimicron difference may cause refractive errors. But here they will not do again laser. They will give a mild power to the. They will prescribe power glasses or contact lenses to the laser therapy. That's all.
Thank you so much, sir. Sir, in auto-reference, if cylindrical power comes positive, how we have to do transposition while prescribing lens?
Once more.
When cylindrical power comes, when we check the lens, when cylindrical power comes positive, how we have to do the transposition while prescribing the lens?
Okay. Oh, you're asking about the prescribing the astigmatism lens, cylindrical lens. Okay. First of all, we are correcting the distant vision. That is, first we are if the patient is myopic, we should apply or we should take minimum minus power, say 0.25, then increase it to 0.5, then the patient will read from the first letter in the slide charter to the next, then next to the, then say to point plus, when it reaches -1, the patient can read the last line, then it's okay. In case of cylindrical power, what happens when we add 0.25, the patient will read the second line. When we increase to 0.5, patient will read the third line. When we increase to -0.75, patient read the fourth line. 0.7, when we reach -0.75, the patient read fourth line. And when we increasing to -1, what happened? The patient vision become blurred. Then we know that 1 meridian of light reached the retina. The other meridian has not reached the retina. So there we stop. That means we are giving -0.7 itself. We will not increase to -1 because even when we are increasing to -1, the vision is getting poor. Then next stage we have. Then myopia is corrected. Then we have to correct the astigmatism. Astigmatism means whether it is myopic astigmatism or hypermetropic astigmatism. Myopic astigmatism is nothing but more than focal point in front of retina. Hypermetropic astigmatism means more than focal point beyond retina. But first of all, we are just blindly we are adding -0.25. Then the patient vision is improving. Then we get to a conclusion that the patient is having myopia. So we are increasing the glass to -0.25, then 0.5, then 0.75. Then the patient will read next line. Then when the power reads 0.75, patient read the fourth line. When the power is increased to -1, what happened? The image is blurred. That means 1 meridian reached the retina. Then next, there we stop. And then next we are taking cylindrical lens that it has an axis. We are putting the minimum power of cylindrical lens. That is, here we are reached the conclusion that it is myopic astigmatism. Then we are putting the minimum power of minus cylindrical lens in front of that lens, in front of that 0.75 spherical lens. Then we are rotating it. Rotating slightly, we are rotating in a particular axis, say in 90 or in 180. We can see that in that trial frame there are so many marks, 0 to 180. We can see when we are rotating at a certain point, the patient become clear. Then we are increasing that cylindrical power. Not the spherical power. Spherical power we are made it constant. Then we are increasing that cylindrical power, say 0.25 at the 90 degree. The patient got better vision. Then we are increasing 0.25 to 0.5. Then the patient can read the next line. Then we are increasing the to 0.75. Then patient can see the last line. In some cases, the patient can't see the last line. We can get the correction only up to the second last line. Then we are rotating that cylindrical lens to right and left, so that in a particular point the vision become correct. Then say maybe normally the axis in most cases 90 and 180 we will get in correct. We will get, but certain cases it may be in the 70 degree, 130 degree. That is subjective. That is why I told you that while taking in computerized eye vision, that the machine is emitting a light rays into the eye, and it is rebound back to the eye. The direction and the deflection or the refraction of the eye that have taken place in our eye will read the can be read by that machine. Then it is taking that machine result from that. With that result, we should place that we should place our lenses in front of eye and just correlate with them whether it is correct or not, because it is only an objective. So we should objective thing. We should make it correct with the, or we could adjust it with our trial set. Then only the vision will be correct. Actually, the machine is just, I told you, just emitting a light rays and rebounding, and it is just reading. But if it is correct, then the patient can see the last line. So first of all, we should correct with the spherical lens at a particular point. The spherical lens will not accept. In that point, we stop that. Then we are adding the cylindrical lens. Then we can get cylindrical lens. Always cylindrical lens has an axis, so we are putting the minimum cylindrical lens in front of that front of the spherical lens. Then we are rotating it. At a certain point, the patient's patient can see the image clearly, or we can read slightly better. Then we are increasing the power of the cylindrical, not rotating, increasing the power of that cylindrical lens. Then the patient is getting more and more better vision. If it is not like that, then we should rotate that to right or left, so that we can get a correct vision.